So, let's talk about something huge happening in Ireland. It's a massive mission to completely reboot the country's healthcare system using technology. The official name for the plan is Digital for Care 2030, and in this explainer, we're going to break down exactly what this blueprint for a digital overhaul looks like.
So, what's really at the heart of all this? Well, it's a frustration that I'm sure sounds familiar to a lot of you. And it's captured perfectly in this quote from patients themselves. You know that feeling of having to repeat your entire medical history at every single appointment? Yeah. That one universal experience is a huge driving force behind this entire transformation. But to really get why this plan is so ambitious, we first need to understand the starting point. And let's just say the challenges facing Ireland's digital health system are pretty significant.
Okay, so here's the honest truth, the starting line. A 2023 OECD report looked at digital health readiness among developed nations, and Ireland was ranked in last place, dead last. It was a huge reality check, and it made the need for change completely undeniable.
This slide really breaks down the core problem. The old way is completely siloed. Now, what does that actually mean in real life? It means your records are basically trapped, stuck in paper files or on computers that don't talk to each other. Your GP, the hospital, a specialist, they might all have a different piece of your story, but nobody can easily see the full picture. The goal is to tear down those walls and create one connected system.
And if there was one single event that just poured gasoline on the fire for this transformation, it was the massive ransomware attack back in 2021. It completely crippled IT systems across the health service. It showed everyone, in the starkest way possible, just how vulnerable the old infrastructure was. That right there became the point of no return.
So, out of that crisis and all the other existing challenges, a new vision was forged. It's called Digital for Care 2030, and this is Ireland's comprehensive answer.
The official vision really centers on a few keywords: seamless, safe, and secure. This is so important because it shows the goal isn't just about throwing fancy new technology at the problem. It's about fundamentally rethinking how health information flows to create better outcomes for absolutely everyone, from patients to clinicians. So how do you make a big vision like that a reality? Well, the strategy is built on 6 core principles. You can think of these as the philosophical pillars, the DNA of the project that are going to guide every single decision from here on out. Let's walk through them.
First, and you could argue most importantly, is putting the patient in the driver's seat. This means giving you more access to your own health information, more choice in your care, and way more control over your healthcare journey.
Of course, you can't have a digital health system without a digitally skilled workforce, right? This principle is all about equipping healthcare staff, the doctors, the nurses, everyone, with the modern tools and the training they need to do their jobs well.
This principle gets right back to that silo problem we were just talking about. The whole goal is to create systems that actually talk to each other, giving clinicians a complete 360-degree view of a patient's health information. That way they can make better, safer decisions.
Principle 4 is all about being smarter. By using aggregated data and analytics, the health service can get a much better handle on demand, plan where resources need to go, and manage services to improve patient care across the entire country.
The 5th principle is all about creating an environment where new ideas can actually flourish. It means fostering innovation, whether that comes from a great idea inside the health service or from working with outside partners on new solutions. And finally, the bedrock for everything else. This last principle is all about building a robust, secure, and resilient digital infrastructure. Because, let's be real, without this strong foundation, none of the other principles are even possible. Okay, so we've covered the why behind this whole thing. Now let's get into the how. What are the actual tools and technologies that are going to make this vision happen?
This right here represents a huge shift in philosophy. Instead of building these one-off, custom-made systems that never talk to each other, the new approach is modular. The Lego analogy is perfect. They're creating a set of reusable digital building blocks that can be quickly snapped together to build new services. This means things get built faster and they're designed to work together from day one.
At the very heart of this new toolkit is the electronic health record, or EHR. Just think of this as the foundation. It's the digital version of your medical chart. But the key difference is it's designed from the ground up to be securely shareable across different hospitals and clinics.
Now, building on the EHR is the Shared Care Record, or SCR. So if an EHR is the detailed chart at one specific hospital,
The SCR is like a master key. It securely pulls key information from all your different records, your GP, the hospital, the pharmacy, and creates one single holistic view for your entire care team. It's a true game changer for integrated care.
Now this all sounds great in theory, but when is it actually happening? Well, this isn't just some distant dream. There's a clear, phased implementation plan that's already in motion.
The roadmap is broken into 3 simple phases: now, next, and future. But the key is that now phase. This isn't just talk. We're seeing tangible projects like the HSE app, virtual patient wards, and the first shared care records rolling out in the first couple of years. The strategy is all about building momentum and delivering immediate benefits to people.
So let's bring all this strategy and tech down to a personal level. What will this transformation actually feel like for you as an individual patient?
The plan uses this character, Mrs. O'Neill, to illustrate the human impact, and it's incredibly effective. So before, she has to repeat her story over and over again. After, her clinicians have a complete shared record. Before, her son struggles to coordinate our care. After, he can access her records with her consent to support her. It transforms care from being fragmented and frustrating to integrated and truly supportive.
Ultimately, the benefits are designed to ripple across the entire system. For patients, it promises better outcomes and more convenient care. For staff, it means less time buried in admin and more time focused on actual patient care. And for the health service itself, it's about building capacity and becoming more efficient for the future.
You know, this entire plan shows that this is so much more than just an IT project. It's a fundamental reimagining of how healthcare is delivered. And it leaves us with a really powerful question to think about. Once this connected system is a reality, what new possibilities for health and wellness will it unlock for the entire nation?